So now we're going to look at navigating a specific form that we find. So we get dispatched to our emergency, we locate the plan that we want to look at, and there's already a few pieces of information we're getting from this plan. This is called a badge, and it represents each STARS plan in the application. This is, of course, the STARS number. This is the primary EMS district that that kid is assigned to, so probably where they live. And then it also tells you the state and county that they're from. Anytime you're accessing for an emergency, we of course ask that you click yes. And then we have our standardized STARS form. And for those of you who have worked with us for a while, you'll recognize many of these components. So there will always be the patient's name at the top, their STARS number, their gender, their age in years, just so you can have another reference to make sure you're looking at the right kid and the right age kid there. A set of well vital signs, which is always important. These should be the last known well set of vital signs so that you can compare those against whatever you're getting on that call that day to see, if, a measurement of if that kid is sick or not. All users have the ability to print in the upper right corner. That gives you the ability to print to PDF or to a local printer if you have it affiliated. And then at the top of every STARS form is the diagnosis, a list of the pathologies that that kid has. We do try to narrow it down to the major ones. You will not find that hospital-style list of 27 different diagnoses here. We really try to focus and prioritize what we think is important for you to know in the emergency. Then in the upper right, you have baseline findings. And in a modern-day STARS form, we work pretty hard on this section to really try and paint a good picture of how that kid typically acts. It's really hard to know if that kid is acting atypically that day if you don't know what is normal for them. And so that's why we work on that section. Anticipated emergencies. These are a list of emergencies that either that kid has previously had, or because of their pathology, we think they're inclined or highly likely to experience that emergency. Obviously not a comprehensive list of every emergency they could have. This is also where you'll find some of the specialty treatment information. If that kid has special orders, what you should do for that pathology or that emergency. Cautionary notes is a section where I really focus on information that I think will affect your normal treatment patterns. And so for instance, if the kid's a known difficult airway, well, that might change the way that you approach airway. Or if they have some hardware in their leg and you can't put an IO in that leg, that's obviously need to know information. Sometimes as simple as just patient positioning. If some of my kids have a lung that's smaller on one side, or because of their musculoskeletal development, they have to lay in certain ways. And so we'll try to include that information to try and make your lives a little easier. Medical equipment, we'll give you the details on that. And then their medication list. The medication list typically does not actually include dosing because a lot of our kids change dosing and meds so frequently. However, sometimes you will find doses in there for things that we think will affect your treatment of the emergency. So for instance, if the kid is on high-dose benzos or pain meds at home, that would obviously affect their mentation and maybe how you approach them that day. We will try to include that information. Allergies, preferred facilities, and their physicians list. So it is of significant note. So we're always thankful to Cardinal Glennon for housing our program, for putting a roof over our heads, and for allowing us to build and work on this awesome project. I do like to remind everyone that not all STARS patients are Glennon patients. We actually have a whole lot of patients that attend St. Louis Children's or Mercy, and then I have a handful out there who attend other facilities in our region. So please always look at what that child's preferred facility is. That is their ideal destination facility for their emergency, and we would like to get them there if at all possible. It is of note both in the facilities and the contact information. Any phone number you see here is actionable. So if you are on a cellular capable device and you click, you will have the option to call straight out of the application to that facility or to that parent or whoever you're trying to reach. Demographics is fairly self-explanatory. And then contact information, their home address, their school address, their emergency contacts. If we have a phone number for their emergency contact, that'll show up. The last section on the bottom right is attachments. Every live form in the application should have a STARS database HIPAA waiver attached to it. And then we're going to look at some other examples of things that can be attached here shortly. The final piece of information at the bottom of every STARS form is the last updated date for that form. Just always to give you some, some clinical clue of, oh wow, this information is, was updated yesterday. Everything here should be good to go. Or, oh wow, it's been 6 months since anybody put eyes on this form. Maybe I should ask mom and dad if anything has changed. All right, so we're going to go back to our dashboard, and then we can always, sometimes there will be other things attached, and so we're going to take a look at that. So depending on what is attached, it might trigger a red banner on the top of your STARS form. And so what this tells us is that this kid has a complex medical care plan attached. And if you would like to see that, anytime you see a red banner, if you click on it, it will just drop you to the bottom of the form to the attachment section. And then you can open up that attachment and take a look at it. And so you'll be able to look at this kid's complex medical care plan. There can be a lot of good information in those. We just think sometimes it's too much for EMS and emergency. Some of those run 6 to 7 to 8 pages, and some of it's not really super useful information for an emergency. I mean, knowing the kid's immunization list back to the beginning of time probably will not facilitate you running an emergency call on them. But there can still be some good information, and especially for my EDs that access, you might find some really useful information in there and procedures and previous history. Some other things that can trigger red banners. So we'll go back and we're going to look at another kiddo. And so if a child has a DNR attached, or a do not resuscitate order, any advance directive, that information will be included here. Once again, we click on it, that drops us to the bottom, and you can very quickly open and look at that order on your way to the call. Whenever I teach on DNRs, I do like to always emphasize the point that parents have the right to rescind the DNR order up to the last minute or the last second. So just because you've seen a DNR on the way to the call, you still might be about to work a full code if you show up and the parents say, we're not ready, or we would really like to try a trach change or 5 minutes of CPR. Or they may kind of help guide you, but at least we've started to have some of those conversations beforehand. They can sort of inform your decision making as you go and kind of help you open that conversation with the parents of what they want done, what they want to see done for their child. All right. And then some final things that can be attached. Not all things trigger a red banner, so you can have a patient photo. You can have some information sheets. For instance, we have the LVAD warning sheets in there. We'll have 15 leads for our cardiac kids. So there can sometimes just be other things that are attached here that you will maybe help guide your treatment a little bit, or else this is just another tool we use for sick, not sick. How is that kid presenting for you today versus a picture of how they should normally be looking and interacting. So, all right, so that is the basics of a STARS form.